So did you finish your assessment and give him the information you need?
I did. I got his physical assessment done, and I got a chance to review the chart while I was in there also.
Okay, so what problems did you identify and what is your plan?
Well, I took his vital signs, and his respiratory rate's normal. He's on room air, setting at 93%. His temps at 99.8. Blood pressure was 94/68 with a heart rate of 98. I'm concerned about his pain. He's on a dilaudid PCA with a continuous infusion. He's also getting oral pain medications every 4 hours, and he has been getting those around the clock. However, it's been 3 hours since his last pain med, and he's still rating his pain at an 8. I'm also worried about his GI system. He's got hypoactive bowel sounds, and he says he's not passing very much flatus at this point, and so I'm wondering if all the pain medications he's getting is impacting his GI system. It's also his first day post-op. He's a 67-year-old patient. He has been in bed since surgery, and so I'm a little concerned about his risk for blood clots. However, I did notice that physician ordered Levinox today.
Okay, so you told me a little bit about your plan and why you chose it. What are your priorities?
I think my priorities will be to get his pain under control, and maybe we can get him out of bed, get him moving around some, which I think will help his GI system and increase his bowel sounds and help him start passing more flatus. I'm also, when I looked at his Levinox, it's due at 9 o'clock this morning, so I want to be sure to give that on time.
Okay. One thing I just want to bring your attention to, so that blood pressure, that's a little bit low. Would you say it was 94?
Over 68.
And what was his heart rate?
It was 98.
Okay, and his blood pressure and his heart rate I think were a little bit different before.
You know, they were.
Okay. So we kind of want to note that blood pressure after surgery, you can have a loss of fluid, you can have a loss of blood, so sometimes patients can start to become a little bit hypotensive.
Okay.
The other thing is you said he's getting a lot of pain medication, right?
Mm-hmm.
He's getting the oral medication and the IV.
And the Dilaudid,
And the
yeah.
Dilaudid, so sometimes that can cause some hypotension as well. So things we want to look for, we want to watch when we get him out of bed, and we want to maybe check his labs and see if that's some blood loss is causing some of that hypotension.
Okay.
And watch his pain medicine, which you've already kind of said you want to keep an eye on his pain medicine.
Okay.
Okay. So you're definitely on the right track for noting his GI and the pain medication and getting him out of bed and how all those things connect, as well as the blood clots. He's definitely at a risk for blood clots. One thing we do want to consider is after surgery, that loss of blood or loss of fluids, and watching that hypotension, and also with the pain medication, so making sure that we're monitoring him for that hypotension and possibly the causes for that hypotension.
Okay. Thank you.
Okay, so sounds like you've got a plan. So
All
go
right.
ahead.
Okay, thank you.
Get started.